Thank you so much for the kind introduction, and thank you so much for the invitation to let me speak on, to give a lecture on health economics in the field of medically assisted reproduction. These are my disclaimers. So as you can see on the graph here, the total expenditure on health as a percentage of GDP has been rising over the past decades in all countries worldwide. This is mainly due to advances in medical science and technology. Differences you see between countries is due to differences in how healthcare is financed and organized. So as we all know, healthcare budgets are fixed, and that is why we need to take into account opportunity costs. Opportunity costs means that if we spend more money on one thing, there's less money left to spend it on something else. So if you decide to spend part of the healthcare budget on a certain intervention, then the opportunity cost of that intervention is everything else you cannot buy anymore because you already spent your money. So that is why we need to measure and compare costs and health outcomes, and we need to set priorities in order to spend our healthcare budget as efficiently as possible and to keep the opportunity costs as low as possible. So that is why it's very important to understand cost effectiveness and the value for money of competing healthcare programs and interventions. So to make sure that cost effectiveness is considered when making funding decisions, health technology assessment bodies have emerged worldwide. So cost effectiveness is estimated through the performance of economic evaluation. So economic evaluation is the comparison of costs and outcomes of two or more alternatives. So if you're not comparing two or more alternatives, but you're just providing a description, let's say, for example, only outcomes, then you're performing an outcome description, so a disease burden study. If you're only providing a description of costs of one alternative, then you're performing a cost of illness study. If you are comparing both costs and outcomes of one intervention, then you're performing a cost per case study. If, however, you are comparing two or more alternatives, then you are performing an economic evaluation. So let's say that you're only comparing outcomes of two or more alternatives, then you're performing an effectiveness study. If you are comparing the costs of two or more alternatives, then you are performing a cost comparison. And if you are comparing both costs and outcomes of two or more alternatives, then you are performing a full economic evaluation. It can either be a cost effectiveness study, a cost utility analysis, or a cost benefit analysis, and those are the ones I'm going to focus on today. The basic idea behind an economic evaluation is to calculate an ICER. ICER stands for Incremental Cost Effectiveness Ratio, and this is a summary measure that is going to express how cost-effective one intervention is compared to another. I'm going to show you by means of an example how an ICER can be calculated. So let's say that you are comparing intervention B with intervention A. Let's say intervention A is standard care, and you have a new intervention B, and you want to know whether this new intervention is cost-effective compared to standard care or not. The first thing that you're going to do is calculate a total cost for both interventions. So for intervention A, the total cost is 70,000 euros, and for intervention B, the total cost is 140,000 euros. Second thing is that you're going to calculate a total effect for both interventions. So the total effect for intervention A is 2 live births are obtained, and the total effect for intervention B is that 4 live births are obtained. Then to calculate the ICER, the first thing that you're going to do is calculate a difference in total costs. So we have 140,000 euros minus 70,000 euros, and then you're going to calculate a difference in total effects. So we have 4 live births minus 2 live births, and then we obtain an ICER of 35,000 euros per live birth. How do you now know, given this ICER, whether intervention B is cost-effective and whether it's worth spending your money on? That is when this graph comes into place, and this is called a cost-effectiveness plane. It's divided into 4 quadrants. Let's say that your ICER would be in this quadrant 4, then it would be quite straightforward what we have to do, because this means that our intervention B would be less effective and more costly than intervention A. So it's quite straightforward that intervention B is not cost effective and we're not going to spend our money on this intervention. If we are, however, with our ICER in quadrant 2, then it's also quite straightforward what we have to do because our new intervention B is more effective and less costly. So it's quite straightforward that intervention B is cost effective and it's worth spending our money. But with our example, we were in quadrant 1, and then it's not so straightforward what we have to do. Because our intervention B was more effective, we had 2 more live births obtained, but it was also more costly than intervention A, because it was 70,000 euros more expensive. So then this pink bullet is our ICER. So then what we need is a cost-effectiveness threshold. That's a country-specific, pre-specified value, so every country has this threshold. Some countries specify their cost-effectiveness threshold, others don't. So let's say that we have a country with a threshold of 20,000 euros per live birth. Then it is said that if your ICER is above the threshold, it's not cost-effective, and if it's below the threshold, then it is cost-effective. So our ICER was 35,000 euros per live birth. The threshold is 20,000 euros per live birth. So we would say that intervention B is not cost effective and we will not spend our money on this intervention. There are different types of economic evaluations that can be performed. The first one is a cost effectiveness analysis. There, the costs are, of course, expressed in monetary terms, and the outcomes are expressed in natural units. So it can, for example, be pregnancy achieved or live birth, and the result, or the ICER, is expressed as a cost per effect. Secondly, we have cost-utility analysis. There, the costs are, of course, also expressed in monetary terms, and the outcomes are expressed in generic health measures. So it can, for example, be a QALY, which stands for Quality Adjusted Life Year, or it can be a DALY, which stands for Disability Adjusted Life Year. And then the ICER is expressed as a cost per QALY. Third type is a cost-benefit analysis, and here not only the costs, but also the outcomes are expressed in monetary terms. So the outcomes can then, for example, be cost saving or willingness to pay. And then the outcome measure is called a benefit-cost ratio, and there the result is expressed as dollars received per dollar invested. So whose perspective that you should adopt for your evaluation depends on who's going to pay for the treatment. So first possible perspective is the one of the patient. Now you're going to try to answer questions like, what's the least expensive path to a live birth? Or given my willingness to pay for a pregnancy, which MAR treatment would be best? And then the desired method is a cost-effectiveness analysis or a cost-benefit analysis. Second possible perspective is that of the healthcare system. Then you try to answer questions like, what's the least expensive way to give infertile couples a live birth? Or how can we improve population health, and is MAR a good instrument for that goal? And then this desired method is a cost-effectiveness analysis or a cost-utility analysis. And then the third perspective is that of society, and you try to answer questions like, how can we improve social welfare, and is MAR a good instrument for that goal? Or how good of an economic investment is MAR compared with other ways of spending public money? And then the desired method is a cost-utility analysis, cost-effectiveness analysis, or a cost-benefit analysis. Which costs you need to include in your economic evaluation depends on the perspective that you chose. So first of all, we have the direct costs. These are the intervention costs. So for example, costs related to consultations, medicines, or laboratory work. And these should be included in a clinic, healthcare payer, patient, or society perspective. Then we have the indirect cost. These are foregone activities, so for example, expressed as work absenteeism or reduced productivity at work, and these should be included in a patient and a societal perspective. And then we have patient costs, so these are extra costs carried by patients, for example, costs related to making the transport, so traveling to the hospital each time, and these should be included in patient and societal perspective. Also, depending on what kind of question you're trying to answer, then also depends on which method is best to use. So if you're, for example, interested in calculating the technical efficiency, so you want to know what's the cheapest option to realize something, so let's say you have a fixed MAR budget and you want to decide which MAR treatments you're going to fund from this budget, then it's best to perform a cost-effectiveness analysis. If, however, you are interested in calculating allocative efficiency and you want to know like how much should we invest in something compared with available alternatives, so you have, for example, the complete healthcare budget and you want to know how much will I spend on MAR treatments, how much will I spend on cancer treatments, for example, then it's best to calculate, to perform a cost-utility analysis or a cost-benefit analysis. So now that I've explained the basics of economic evaluation, I would like to introduce you to a systematic review that I wrote on economic evaluations performed of medically assisted reproduction. So in this review, we included 76 economic evaluations reporting on the cost effectiveness of MAR treatments published between 2010 and 2022. And we included 93 ICERs in our analysis, given that some articles published more than one ICER. So as you can see, most of these studies were published between 2015 and 2022. The most adopted type of economic evaluation was the cost-effectiveness analysis. And then on the left side here, on this graph, you see the time horizon. That is actually the period over which costs and outcomes are counted in an economic evaluation. And you can see that it was there are a large variety of time horizons, but most of them were very short time horizons with mostly adopted one treatment cycle. The most used perspective was that of the clinic, so of fertility clinics, and the most calculated outcome was a cost per live birth, followed by a cost per pregnancy, and you can see that only 2 of them calculated a cost per quality. So as I said, the most performed type of economic evaluation was a cost-effectiveness analysis calculating a cost per live birth. So this is a straightforward metric of cost effectiveness. It's able to indicate that one MAR intervention may be more expensive per treatment cycle, but may also be more effective. So it can actually have a lower cost per live birth. It's able to show patients the most economic way to reach parenthood, can also inform policymakers about which MAR program to fund from a fixed MAR budget in order to maximize the number of live births. But it can, however, not inform policymakers about the relative size of the MAR budget compared to the budget for other healthcare interventions. So then we have the cost-utility analysis, calculating a cost per quality. So this would signal to policymakers how much health can be bought per euro invested in MAR. The advantage here is that we can compare cost per quality calculations from the field in MAR to cost per quality calculations to other fields in healthcare. So you can, for example, a cost per quality that is calculated in the MAR treatments, you can compare it with a cost per quality that was calculated for cancer treatments. However, the difficulties here is that it's unclear whose qualities should be counted. So those of the mother, of the father, maybe also of the future child. If you were to include the qualities of the future child, you would make MAR treatments become extremely cost-effective because you add a lifetime of qualities. However, if you were to exclude qualities of the future child, it would be kind of saying that they have no value whatsoever, and that also feels incorrect. Second question is, what should be counted in those qualities? And that's a difficult question because, as I said, cost per quality indicates how much health can be bought. And in literature, there's large discussion going around, and infertility is not always considered as a disease because it doesn't really improve health, it rather improves well-being, and that is not captured by a quality. So that's why it's very difficult to calculate cost per quality. So the third type was a cost-benefit analysis. So here you compare the MAR costs with the MAR returns. The advantage here is that the usage of a cost-benefit analysis is not limited to the healthcare sector. So you can, for example, answer questions like, would it be more attractive to spend money on MAR treatments or on building libraries? Because everything is expressed in monetary terms, so that's universal. The most published cost-benefit analyses are, however, partial evaluations. They monetize only selective MAR costs and outcomes, and we would need full cost-benefit analysis to really say something about the return of investment of MAR treatments compared to the return on investment of other instances. So the goal of my systematic review was actually to compare which costs and outcomes are currently included in economic evaluations, and to compare this with what HTA guidelines actually say that should be included in economic evaluations. So in order to do this, we tried to capture the full MAR pathway, so all the consequences of undergoing MAR treatment in terms of costs and outcomes. And that's why we created this overview. So we found 12 cost categories. We started with costs related to the infertility diagnosis, costs related to MAR treatment itself, to pregnancy delivery, postnatal follow-up care, to basic and complicated child care, care for involuntary childlessness, so after a failed treatment cycle, productivity losses due to treatment and pregnancy and child care, broader long-term social impacts, and the non-healthcare related out-of-pocket payments. And then for the effects, we found 9 categories. We found the natural units, the health of the child in the short and long term, well-being of the child in short and long term, the health of the parents in short and long term, and the well-being of the parents in short and long term. So with this overview, we try to capture all the consequences of undergoing MAR treatment. So I will show you now the table on how we presented the results of our systematic review in the paper. So here on top, you can see the different cost and effect categories that I just showed you. And then on the left side, you can see 3 different outcome measures. So these are all outcome measures that come from a cost effectiveness analysis. And next to it, you can see the different perspectives that we included. So you have C stands for clinic perspective, H for healthcare payer perspective, P for patient perspective, and S for societal perspective. And the different combinations, so the combination of an outcome measure and a certain perspective, creates a different evaluation objective. So try to answer different types of questions. So this is how we summarize the results of our systematic review. So I will walk you through it. You see a combination of colors and percentages. So the colors indicate what HTA guidelines say about which costs and effects should be included depending on the outcome measure and the chosen perspective. So green colors indicate costs and outcomes that should be included. The blue colors indicate costs and outcomes for which HTA guidelines are rather ambiguous, and the red colors indicate costs and outcomes that should not be included. And then we have the percentages, and that indicates the percentage of the studies included in our systematic review that accounted for a certain cost or effect. So as you can see, first observation is that costs related to infertility diagnosis were almost never included, whereas these are all green boxes, so HTA guidelines say that it should be included, and it's also the start of the treatment, so it's quite straightforward that it should actually be included. So here you see a lot of 0 percentages, but these are in red boxes, so that's actually fine. That's the rest of our table. So we have included 2 more outcome measures, so the cost per quality and the benefit cost ratio. And here you see that there were way less studies that calculated a cost per quality or a benefit cost ratio. And you also see there are lots of low percentages also in the green boxes, so lots of costs and effects were actually ignored in these broader analyses. So to conclude, economic evaluations aim to identify efficient healthcare based on value for money. And efficiency depends on the goal that is trying to be achieved. So there's not one single universal definition of what constitutes cost effectiveness. However, there are several methods and they all answer different questions. There are many challenges when we try to apply HTA guidelines to the context of MAR. The perspective matters, who pays and which costs are neglected. The outcome also matters, which decision problems need to be analyzed. So MAR actually highlights several gaps in the current HTA framework. So we saw that the cost per live birth was the mostly used, and this is relevant for patients and policymakers to show them the least expensive way to reach parenthood. However, these are narrow and short-term calculations, and they cannot inform policymakers to make reimbursement decisions. For these decisions, we need broader analysis like cost-utility analysis or cost-benefit analysis because they offer more information on the value of MAR. However, there are many unresolved questions about how to perform these types of analysis in the context of MAR. So our final conclusion is that we need further conceptual research on the development of HTA methodologies in the context of MAR. Thank you so much.